Syphilis is one of the 10 most common sexually transmitted infections, or STIs. It can be cured with antibiotics, but cases are still up 52% since 2016. Hi, I'm Dr. Kevin Ard, and I'm an infectious disease doctor at Massachusetts General Hospital. So what is syphilis? Syphilis is an STI that is highly contagious and is passed by skin-to-skin contact when someone touches a sore on another person. These sores can be on the penis, the vagina, the anus, the mouth, or the tongue. These sores are usually not painful, so people may not know that they have them. The disease is normally transmitted during sexual contact, but a pregnant person who has syphilis can also pass the disease onto the unborn baby. This is called congenital syphilis. The genital sores caused by syphilis also make it easier to become infected with and to transmit HIV. If you have sores you're worried about, it's important to see a doctor. Syphilis symptoms can be confused with other infections like impetigo or monkeypox and other STIs, also called STDs, like human papillomavirus or HPV and herpes. So what are syphilis symptoms? There are 3 stages of syphilis: primary, secondary, and tertiary. Syphilis is most infectious during the first 2 stages. Primary syphilis begins with a small, round, painless sore, also called a chancre, which usually appears where the bacteria enter the body. This normally occurs about 3 weeks after infection, but it can take up to 3 months to appear. The sore remains for about 2 to 6 weeks and resolves even without treatment. Secondary syphilis can cause a range of symptoms. Classically, it causes a skin rash. The rash can be anywhere on the body, but often involves the palms of the hands and the soles of the feet. It can also cause fever, sore throat, headaches, fatigue, weight loss, swollen lymph nodes, hair loss, and aching joints. These symptoms are very often mistaken for other diseases and are the main reason why syphilis is called the great imitator. The symptoms will eventually disappear, but if you haven't been treated, you'll still have the disease. If someone with secondary syphilis is not treated, the infection will persist without symptoms for years, and they could develop late-stage or tertiary syphilis. Heart problems, neurological problems, and tumors may occur, leading to brain damage, blindness, paralysis, and even death. At any stage, syphilis can affect the brain, which can lead to meningitis, problems with hearing and eyesight, and other neurological symptoms. So how is it diagnosed and treated? The test for diagnosing syphilis is a blood test. If your provider suspects syphilis affecting the brain, they may test your spinal fluid for infection also. All pregnant people should be tested for syphilis to prevent the possibility of congenital syphilis, which could be fatal for the newborn. And syphilis treatment? The good news is that a single injection of long-acting penicillin can cure the early stages of syphilis. This includes primary and secondary syphilis. You can treat syphilis of longer duration or tertiary syphilis with 3 doses of penicillin at weekly intervals. Treatment may be different if the syphilis affects the eyes, the ears, or the brain. Treatment will cure the infection and prevent further damage, but if the infection is in its late stages, it will not repair damage already done. Speak to your doctor about the right treatment for you. If you have an allergy to penicillin, your doctor can discuss treatment options with you. If you're sexually active, your partners should also be treated. Don't resume sexual activity until you've completed your treatment. At the end of the day, syphilis can be prevented by using condoms for sex or reducing the number of sex partners. It's also important to be screened for STIs on a regular basis. Thanks for watching. I'm Dr. Kevin Ard. For another video on STIs, click here. And don't forget to subscribe.